And it's A Leg Up with Dr. Randall Juleff from the La Bella Vita Laser and Vein Center. The podcast about how you can keep your legs healthy and strong so you can put your dancing shoes on. I'm Spud McConnell here with you and Dr. Randall Juleff, so let's get right to it. Okay, we're back again. It's been a exciting 2 weeks while Dr. Juleff is over in Hawaii treating all of his patients over there in the land of grass skirts and coconuts. How you been, Randy?
I'm doing good, Spud. Yeah, things are going well.
I'm glad to hear that. Things are okay over here. We miss you. Let us know when you're going to come back to South Louisiana, because I know there's a lot of people over here who want to stop by your Mandeville office and get checked out. Randall Juleff, for those of you who don't know, are just tuning in with La Bella Vita Vein and Laser Center, is an expert in venous insufficiency and vein issues. Started out as a thoracic, you were a heart surgeon, and you now do this.
Yeah. My original training was in vascular and cardiac surgery, and I did that for a good number of years. But about 10 years ago, I guess, I kind of decided to segue into strictly treating veins and venous insufficiency, and it's been a very rewarding journey for sure.
Well, I know some people in the medical profession who have spent several years in situations where, unfortunately, their patients die, and it kind of gets to them, and after so long, they move to just as important but less situations where you lose patients. And I'm not going to ask you if that were the case, because I know your reputation as a vascular surgeon was very, very good. But, this what you do now, I mean, while you can die from venous insufficiency if you leave it untreated, chances are one visit to your office is probably improve your chances of survival from a whole bunch of things tremendously. Am I incorrect in saying that?
Yeah, no, you are correct. Absolutely. Some of the reasons why I made the change was because the world of vein care, modern vein care, had changed so much just in recent years, just over the last 20 to 25 years. There have been devices, and from a technological standpoint, it's the treatment has really been revolutionized, and it's made the treatment so much better, so much easier for patients. We used to take people to the hospital, and they were admitted, and the procedures were done under general anesthesia, etc. They were in the hospital several days, and that has been transported completely to in-office setting and very minimally invasive kind of procedures. To say I have to say that, yes, I've got much less stress in my life now as opposed to before, when I was doing open heart surgery and that kind of thing. So that has been, an improvement in just my quality of life. But I got to tell you, I have never, in all my years of treating other types of problems, I never had the general good, patient satisfaction just across the board that I have seen until I got into the vein world. I mean, people really do have symptoms and suffer substantially from this thing that we call venous insufficiency. And I think for many, many years, the medical community in general sort of minimized venous insufficiency and the treatment thereof, and kind of sloughed off, complaints by their patients related to that. And part of it was the fact that, the treatment in many cases often wasn't very appealing. But now that it is much more appealing, much more palatable to patients to be treated, we see the improvement in the improvement in the patient's quality of life. And I've never had as many happy patients as I have now,
Yeah.
since I'm treating it, exclusively people with venous insufficiency, because we really do impact not symptoms and quality of life, and it's rewarding for me, to be able to do that.
Well, you got to be happy in your work. I mean, like I said, if you go home feeling much better about yourself and what you've actually accomplished, then that just makes you a better doctor, which makes for better patients, because they have, when I go see a doctor, which I try desperately not to do, because I'm like most men that I know who just don't like going to the doctor.
Yeah,
And I don't know, maybe
sure.
it's because once you hit the age of 30, they feel they have to put on their rubber glove and look for their car keys somewhere. But
Yeah.
take off that dive watch, for crying out loud. Um, but and I'll tell you something else. I was thinking about it while you were talking there. It's like, so many different things that can be wrong with you, or so many different things, like you said, when doctors kind of blew off venous insufficiency. The number one killer of women that I'm aware of is heart attacks. And I know a lot of time women have the symptoms of a heart attack, but they just go, well, you're not a man. Men get heart attacks. Women don't get heart attacks. And so, I don't want to sit here and make it sound like that I'm shaking my finger at the medical profession, but, it seems like you're a specialist in this field, and you're very good at what you do, and you were very good at what you did before. But it would seem to me that your regular country doctor, like a master, a jack of all trades, master of none type of deal, would be able to recognize a lot of things and send you to these specific things, so that more people would realize that there is such a thing as venous insufficiency. Like I said before, I never even heard that term until I met you through the radio. So,
Yeah.
and I've learned so much just in my visits to you, and in my conversations with you on this podcast, and I've learned so much that I now look at myself. I relook at my diabetes. Just enough of the information that I have to be dangerous is already improving my health.
Yeah. Yeah. Well, awareness is a huge thing for sure. And part of the, you mentioned, the, country doc, or, family physicians. So much of the stuff that we do is relatively new. So if you went to medical school and had your, primary medical training before, let's say, 15 or 20 years ago, you were, as a primary, care doctor, as a family physician, you were not in any way, shape, or form even exposed to, the kind of stuff that is available right now for venous insufficiency, nor were you probably even taught, what venous insufficiency was all about, which kind of goes back to, how the medical community kind of ignored vein disease for a long time. But, with respect to circulation, it was all about the arterial side of it, like you mentioned, heart attacks and strokes and aneurysms and all that sort of stuff. So I think that your general family physician has a much better grasp and understanding of arterial disease than they do of venous disease. So that's part of it too. They weren't taught. They weren't exposed to the information, which is another reason why I spend a fair amount of time just going around and talking to doctors, and letting them know what we do, and the patients that we should be seeing, and if your patients have these this set of problems, then send them our way, and we can probably help you treat that patient. So and invariably, no matter how sophisticated those physicians are, when we stop in and talk to them, there's always something that they kind of learn, as far as what we're doing. And so in the long run, we hope that it kind of, filters down and gets to their patients, and their patients are able to get to us,
Well, I'm sitting there thinking about, like, the couple of times I've had surgeries, I mean, I had a lot of, my appendix blew up and, I had whatever. But I had a couple of meniscus surgeries on my knee, which, my doctor tells me I need another knee. But I'm going, well, I'll drive out to New Orleans East to one of the junkyards and see if I can find one for free. But, when they put, like we talked about before, about the compression socks, or those big inflatable things that they put on your legs to make sure that you don't end up with deep vein thrombosis, which is something else I want to discuss. Why isn't now, because of so many things that you're learning and are sharing your information with other doctors, why is there not somebody with one of your ultrasound machines in a recovery room checking out somebody's legs to see what their venous thing is like, what condition they're in, and might be able to determine whether or not they need one of these big compression leg things, or they need to put more compression in it or something like that? I mean, I know of your clinic. You got 5 clinics in Hawaii. You got a couple here in the state, and you're tied up with somebody in Destin. I mean, how many? There's no venous insufficiency guy at a hospital that I'm aware of. So, I mean, how many guys like you are there?
Well, most of the modern vein care that happens these days happens totally as an outpatient. So, do we? I don't really even go to the hospital anymore. After I stopped doing surgery in the hospital, I kind of made my exit, and that was it. So, we don't really have that kind of opportunity to be in a hospital, with an ultrasound machine and just kind of screen people.
Mm-hmm.
That people would probably frown on that. But I will tell you.
No, what I'm saying is, like, how come there isn't, like, okay, when I went to your office, you didn't actually do the study on me. You had somebody who was trained, a tech who was trained with the ultrasound to do it. And he called you into the room because he couldn't believe that I didn't have the worst case of venous insufficiency he'd ever seen, because my legs are so splotchy and ugly, But, I mean, with all the stuff that you know now and all the things that have been discovered, why isn't there at least 1 tech or 2 techs in a hospital that could make that kind of determination, especially after major surgery on a patient?
Well, I don't know. That probably is not the best venue for that. Now, do we? We try to go to, situations where there might be a large number of people, and for instance, health fairs. I mean, we try to go to as many health fairs as we can. Now, obviously, over the last year and a half, that hasn't been happening. But whenever we hear of a community gathering that may be somehow connected with medical issues or whatever, so we'll try to show up, and often we'll have a table or a booth or whatever, and invariably, if we are doing that, we will have one of our techs go with one of our portable ultrasound machines and screen people. Mm-hmm. And that we pick up, we identify people with vein disease all the time in those kind of settings. Periodically we'll go to health clubs and do the same thing, just kind of be there and be available to do screening ultrasounds for people who want it done. So those are the kinds of things that we do. Not only do I go out and try to meet doctors, but I do, community talks, if there's a club kind of thing somewhere, or, a retirement group or whatever, wherever 2 or 3 people are standing around doing nothing, I'll come and talk to them. Yeah. That's I guess those are the main ways that we try to get information out, and doing this kind of stuff, doing the podcast and radio interviews and that sort of thing. Because there's a lot that is not known about venous disease, not only amongst lay people, but also primary care physicians, and we just try to get out and educate people.
Well, let's do a little educating here on this podcast. When the last time we spoke, We talked about what to look for, what kind of symptoms are there. They're not always obvious. We did speak about genetics. So if you've got both parents who have some issues with vein disease, then there's a good 90% chance you're going to have it. But you can still get this. And if you are genetically predisposed to do it, you can find this out pretty early in somebody's life. You can discover the beginnings of it when they're in their 20s with your ultrasound machine. But what else should we be looking for? You talked about before of being swelling in your legs. I mean, everybody else would be thinking varicose veins and spider veins, but you can have the best, healthiest looking pair of legs, and you can still have venous insufficiency. So what do they need to be aware of? When they hear the word venous insufficiency, they need to go, well, what if I got that?
Yeah. We started last time. We started to talk about those other symptoms, and I think we mentioned achiness, heaviness, and fatigue. Those are the three most specific symptoms related to venous insufficiency. And by that I mean, if you have that, then it's probably very likely that you do have venous insufficiency. And if we treat it, those types of symptoms are treated very, very well. People feel like their legs get tired quicker than they used to. People feel like their legs are heavy, and that's one of the things that we very, very commonly hear after people come back and after they've been treated and they've recovered, and they say, "Oh, gee, my legs they feel so light now." And that kind of goes to that fatigue, heaviness, kind of thing that goes on when your veins aren't working right.
And that would be what young people should be thinking about. Before they have, I don't have varicose veins, I don't have spider veins, I don't have lesions or not necessarily much swelling or anything like that, but just the fact that they're achy, their legs get fatigued pretty easily, that's the kind of things they should be looking for.
Exactly.
What about older people? What should they be looking for?
Well, same thing. But I think probably as the years go by, and as the longer that chronic venous insufficiency is happening, then the next stage is swelling. And there's a clinical classification of symptoms for venous insufficiency. Early on, it's achy, heavy, fatigue, and maybe some superficial evidence like spider veins and varicose veins. The next level up is swelling. So by next level up, we mean venous insufficiency, probably a little longer lasting, probably a little more severe. If you're working all day long, especially if you're somebody who works on their feet, and they notice that, by the end of the day, their ankles and their feet are swollen, or, if they've got socks on, they take their socks off and they see that, impression from, where the sock was.
Or if you're wearing your favorite pair of shoes and at the end of the day, they're like super tight.
Yes, yeah. Or the other thing is, we hear this all the time. I was on a plane ride, took my shoes off, and it was a long plane ride, and by the time I got to where I was going, I couldn't get my shoes back on. So, we hear that story a lot. But, so swelling, the single most common cause for swelling, across the board is venous insufficiency. Now, there are other things that can cause swelling. For instance, people with heart disease or, other medical issues, there's plenty of those kind of things. But, as far as the single entity that causes swelling, venous insufficiency is way up there. So then the next set of symptoms, as it gets worse, we start to see skin problems. But before we get there, in this, we see, especially in a little older age group, is muscle cramping. Charley horses. When you wake up early in the morning and you got this terrible cramp in your leg.
What I found? I found if I wake up, I'll wake up in the middle of the night and roll over and stretch, like
Stretch,
and
yes.
boom, that's when the Charlie horse will hit me.
Exactly.
And it's like, so just going out and eating a couple of bananas is not going to fix it.
It may not. Yeah, if eating a couple bananas doesn't fix it, then there's probably something more going on.
Yeah.
Yes.
Okay.
But yeah, that is exactly, Spud, what we hear all the time is, gee, I woke up and I, stretched my legs and boom, that cramp. And that, especially affects adversely older people. Once you get into your 70s and 80s, if you have a muscle cramp in the middle of the night, it's a little bit harder for a mid-80-year-old person to jump out of bed and maybe walk around a little bit, stretch the muscle, and get that cramp out. It's a lot more difficult for that person to just physically do that sort of thing than it is when you're 30 or whatever. So we see a lot of more of the older age group patients that cramping can be their primary symptom, and in fixing their veins. I mean, they're just overjoyed because the cramping was interfering with their sleep, and it happening on a nightly basis, and it really impacts their quality of life.
What is a cramp? I mean, why does your muscle get knotted up? Is it a blood thing and a nerve thing, or is it just the blood thing, or how does fix? I know it's a symptom. How does fixing the veins make the cramping go away?
Yeah, I think the cramping is primarily due to the fact that the muscle becomes congested with blood because the venous return of blood out of the leg back up to the heart is so inefficient. So with venous insufficiency, the blood sort of pools down into the lower leg, and it takes. It's kind of the analogy I often use is it's kind of like a dam. You put a dam on a river and you develop this huge reservoir, and that's what's happening in our legs. The venous system can hold a lot of blood. As the blood settles down into the lower leg, there's tremendous volume of blood that can just kind of settle there and sit there for a while.
Yeah.
And that's why people pass out when they're, standing up at a, graduation or, some kind of ceremony. Every now and then you see somebody, topple over because they've passed out. Well, what's happened is that much of their blood volume, because they're standing again in one place, not moving around, those muscles are not contracting, which facilitates blood return. The blood is kind of settling down into their legs, and then at some point, it affects their blood pressure, and boom, they pass out. So I think that's probably the physiology behind it. But cramping, hardly anybody knows that cramping can be a symptom of, vein disease. Invariably, if people come in to the office and they say, gee, I have a terrible problem with cramping. And, invariably they tell us that, oh yeah, we heard about that on your, radio commercial or your podcast or, one of your whatever marketing kind of things, because they had no idea. So, cramping is a big symptom, and again, it affects older people a little more.
Yeah, but
in a much more dramatic way.
I keep thinking about all the saints' practices when they're out there in the heat, especially, and so many of them. And it's get cramps, and they got to bring them in and feed them intravenous fluids because I guess they're not drinking enough. But also, it seems to me like it's almost the same ones over and over again. Like there's some of them who are more susceptible to the cramping, and I'm wondering if they wouldn't benefit for you kind of show up one day with your machine and have a look-see.
Yeah, well, actually, that's a pretty good point. Yeah, I mean, dehydration does cause cramping for sure, but if it's happening repeatedly and more so in one individual than another, they may very well have a component of venous insufficiency for sure. The other thing, another symptom is something that we call restless leg syndrome. And a lot of people haven't heard of that. Or people may have heard about it but don't really understand it.
I don't understand it, but it sounds like a good joke. It's like a Robert Klein joke, I can't stop my leg. I can't. Yeah. But I mean, restless leg syndrome. It sounds to me like you're sitting there and all of a sudden your knees start shaking, or something like that.
Well, not necessarily like that. That's sort of nervous leg syndrome. But restless leg has to do with the fact that some people when they're just sitting around, they're sort of unconsciously moving their legs or flexing their foot up and down or just kind of, moving their legs in one way or another. And they do that because their muscles are contracting, and that helps the blood return up their leg. It facilitates venous blood flow. So they have venous insufficiency. Blood starts to pool in the lower leg, and the leg gets uncomfortable, and then they sort of, again, unconsciously start to move their leg to facilitate that blood flow by muscle contraction.
My wife will all of a sudden just start tapping her foot and not even hardly realize that she's doing it, and she has complained of what she jokingly calls fat foot. It's not every day, but every now and again, she's got her shoes, she takes them off, and they're, like you said, you can see the imprint of her socks or her sandals or something like that. And then at night, we'll be watching TV or something, and we're going, Ma, cut it out, and my kids are yelling because they can't hear the show because she's tapping her foot. So I guess we're going to have to come see you when you come back to
maybe, I mean, that what you're describing could very well be a symptom, classic restless leg is described more when people first go to bed. So when they go to bed, again they become their body becomes still, and they start to recognize that their legs are uncomfortable or achy, whatever, from being up all day long, and that's when the legs become restless, and they're doing that again to kind of relieve the achiness. And to an extreme, restless leg can actually be something that wakes people up multiple times throughout the night. So that is as bad as cramping because, it's interfering with your sleep pattern, and really, it starts to impact quality of life.
And eating a couple of bananas ain't going to fix that. Not even close.
Probably not. Okay. Probably not.
We're coming to the end of another episode here of A Leg Up with Dr. Randall Juleff. And I still got a stack of notes here, questions I got to ask you, but we still got a lot of podcasts to do. So enjoy Hawaii, and I guess we'll talk to you again in a couple of weeks, Doc. Thanks for taking the time.
Sounds good, Spud. Thank you.
Dr. Randall Juleff from La Bella Vita Vein and Laser Center. Go to labellavitavein.com to find out more and to make your appointment. If you think you have some of these symptoms, believe me, it's very easy, and it makes a whole lot of difference in your life. Talk to y'all next time. Thanks for joining us here. Make sure you tune in next time for more information about how you can keep your legs happy and healthy here on A Leg Up with Dr. Randall Juleff from La Bella Vita Laser and Vein Center. See you next time.